India has reported its highest daily COVID-19 death toll, with 3,780 fatalities recorded on Wednesday. More than 382,000 new infections were reported in just 24 hours. Pressure is mounting on the government to impose a nationwide lockdown, and the central bank has announced it will release $6.7 billion to finance vaccine production in the country. Maddock reports.
It's an agonising wait for news. COVID-19 patients enter knowing the hospital doesn't have the supplies to save their lives. They enter knowing they will likely never walk out.
At present,
our hospital has about 300 beds. More than 200 of them are being used to treat patients, but we are not able to fill the remaining beds because we are facing an acute shortage of oxygen. Our supplier just can't meet our needs.
On average, 150 people in India are dying every hour. That's only those registered in hospitals. Many more are dying at home or on the street without any health care. Then some families are left to dispose of their bodies themselves.
I saw dozens of bodies coming in, and there weren't enough places or wood for cremating the bodies. I asked workers I could cremate the body. They told me I can just burn it wherever I can make room.
The desperately underfunded healthcare system needs an injection of cash, and fast. So India's Reserve Bank has released $6.7 billion in cheap loans for vaccine makers and other emergency health services. It will allow commercial banks to borrow from the central bank and then lend to hospitals, oxygen manufacturers and even patients.
We will work in close coordination with the government to ameliorate the extreme travels that our citizens are undergoing in this hour of distress. We are committed to go unconventional and devise new responses as and when the situation demands.
The Modi government is facing louder calls to impose a second national lockdown. Even the country's leading business groups are banding together to demand additional restrictions to safeguard lives. And the Reserve Bank insists the impact of a total lockdown would be minimal.
Businesses and households are learning to adapt. Consequently, the dent to aggregate demand is expected to be moderate in comparison to a year ago.
The Prime Minister says a national lockdown should be the last resort. Most people want to know how much worse it will get, just how many people have to die before the government takes action. Maddock, TRT World.
Well, let's get more on this now with our correspondent Ishan Russell, who joins us from New Delhi. Good to have you back with us, Ishan. India, as we heard there, has reported another grim milestone, another record rise in the number of people who have died from COVID-19. The World Health Organization says India now accounts for 1 in 4 of all COVID-19 related deaths in the world. Can you just update us on what the latest situation is now?
Well, the situation, if I may say, has remained quite the same, and that's the worry, that for the past 10-12 days since we've been speaking, the situation on the ground hasn't changed all that much. There might be marginal improvement, there is aid that is flowing in, but the question still remains that oxygen shortages that places like Delhi and other parts of India were witnessing, those still remains. That last mile connectivity, that all that oxygen that is being transported around the country, that last mile connectivity to hospitals is proving to be a big challenge. So in India, there are two kinds of deaths that are happening. One, of course, people who are dying from the infection, and the ones who are dying because they could not get the medical help and attention that was required. So it's a double catastrophe that is playing out over here. But hopefully efforts now are being made, at least in some measure, to arrest the curve of the virus, to break the chain of transmission. But given the record numbers that India is showing every day, close to about 400,000, every 3 days India gets 1 million new cases. That is the big worry, because as it is, the hospital infrastructure is overwhelmed, and as this caseload keeps increasing, and mind you, we're not close to the peak of the pandemic. Even by the government's own estimates, it will be sometime mid-May. Other modeling suggests suggests that it could be even later. So the real fallout from this pandemic is expected to rise, especially over the next 1 month.
It's interesting that India's Reserve Bank has now intervened to boost lending. Normally, central banks act in a country to boost economic activity, but they're also looking to help with the actual medical response to this second wave. Can you tell us more about what they've announced?
Yes, as far as the central bank is concerned, right now India has a challenge in terms of ramping up its healthcare infrastructure really, really fast. It's a billion-plus population that is at risk. And the steps that have been taken by the Reserve Bank certainly are welcome, because these loans, especially over the period of the next 1 year, to vaccine manufacturers, to hospitals, to healthcare equipment manufacturers, will certainly prove to be a fillip to the entire healthcare infrastructure that India should have already perhaps had in place ever since the pandemic struck in 2020. But even it's not too late to start now. As per the government's own principal scientific advisor, there is a third wave that is imminent. So even as India is grappling with the second wave, the focus should not be lost on developing that healthcare infrastructure to even be prepared for a third or a subsequent fourth wave. So that's the challenge. But in terms of the immediate relief that the Reserve Bank is also being able to provide the government, it is mopping up government securities, purchasing about $5 billion worth of government securities. So that means the government would have more cash in hand to help out with the efforts to deal with this pandemic.
As you say, international aid has been arriving in India from places like the US, the UK and Europe. These include supplies of ventilators, vaccine and other medical equipment. But there have been some complaints in India that hospitals simply aren't receiving these supplies. Can you tell us what's happening there?
Well, that supply has started, especially over the past 24 hours. There have been oxygen generating plants that were imported and put up in hospitals like All India Institute of Medical Sciences in New Delhi. But here's the challenge. The Indian government, while that entire aid was coming in, as local media reports have suggested, did not put in the SOPs, the standard operating procedures, how to deal with this aid that is coming in. So as that SOP was being established, there was that delay, and that delay, every delay right now, is costing lives. So thousands of oxygen concentrators and oxygen cylinders were stuck in customs. They are being cleared expeditiously now. The Indian government has put out a whole list of areas where this medical aid would be supplied. So hopefully that starts trickling in and provides some kind of alleviation to the people who are suffering.
Okay, Ishan Russell, we'll have to leave it there, but thank you so much again for updating us on the situation in India.